So cancer survivors suffer multiple injuries to the cardiovascular, pulmonary, and skeletal muscle systems. The normal function of all three in unison is what we commonly call physical fitness. So you need all three. You need good cardiovascular system, you need good lungs, good pulmonary system, and you need strong muscles, and that produces physical fitness. However, the cumulative effects of various insults, what we call the multiple hit theory, impact on our ability to remain physically fit after a cancer diagnosis. There's the direct adverse effects of cancer. There's the common risk factors that we talked about. The obesity, hypertension seems to be more prevalent in the cancer population. There's also indirect effects. We talked about physical deconditioning. We talked about poor nutritional status. Sometimes you lose weight, sometimes you gain weight. But as a consequence of these multiple hits, cancer survivors living at least 5 years beyond their initial diagnosis have about a 1.5 to 3.5-fold increased cardiovascular mortality risk. So we need to have strategies that are directed to offset these effects of anti-cancer therapy. So cardiac reserve is a measure of fitness. Poor cardiac reserve is bad. We know that from a bunch of different populations, not only cancer populations, even cardiovascular populations, lung populations. Fortunately, there's a potential remedy, and that is aerobic exercise training. That's the most effective way to improve cardiac reserve. This is a study of childhood Hodgkin lymphoma survivors. The risk of any major cardiovascular event was reduced by more than half when the study participants exercised for at least 3 days a week for at least 20 minutes each time. Now, there's something on that slide called MET. So what's a MET? The use of METs, or metabolic equivalents, it allows us to quantify exercise intensity. Okay, 1 MET is the amount of energy in calories burned at rest for each minute. Okay, so an ordinary man generally burns 70 calories in 1 hour at rest. A woman burns about 60 calories at rest over an hour. So METs allow us to kind of assess activities for how quickly we will burn calories doing that particular activity. There's also a bunch of online calculators, and we'll go to the next slide there. Well, this just shows you that 9 MET hour per week figure, that's that 30 minutes a day, at least 3 days a week, or getting close to that 150 minute of exercise that the American Cancer Society and the American Heart Association recommend. The benefits do continue as you exercise more, but the amount of additional benefit with additional exercise seems to plateau off. So that 9 MET hours per week seems to be the important cutoff point. So you want to try to at least get to that level. So this is an online calculator. It's free. You just go metcalculator.com on the internet, and you kind of scroll down these things. After work, I try to exercise on my home treadmill for about an hour, if I can. And I set, it's walking, it's on a treadmill, it's 3.5 miles an hour at 9% grade. And so when I scroll down, I put that information in, it shows that activity is 8 metabolic equivalents, 8 METs. And even tells you how many calories burned, a little over 600 calories. But brisk walking on level ground, that's about 3.5 METs of intensity. So 150 minutes a week is about 2.5 hours. 3.5 times 2.5 is almost 9 METs. So that's where you get that 150 minutes a week that they should strive for. This is a review of 100 studies. So they pulled up a whole bunch of studies from various databases, and they reviewed them. They combined the data, and they showed that patients who exercised following their cancer diagnosis had fewer cancer-related adverse effects. So now we're not even talking about heart disease anymore. We're talking about cancer. Patients who exercised following their cancer diagnosis had fewer cancer-related adverse effects and a lower risk for both cancer recurrence of their primary and development of new primary in the future. Exercise is not only good for the heart and overall fitness, but it also prevents cancer. This is all types of cancer. So again, the American Cancer Society and the American Heart Association, they recommend 150 minutes of moderate aerobic exercise per week. But what if you can't exercise that much? What if 150 minutes a week is too much? This 2011 study published in The Lancet demonstrates that less is okay too. Individuals who averaged only 15 minutes of moderate exercise most days had significant health benefits compared to individuals who were inactive. Getting up and doing a little is better than doing nothing. And so even if you look at this graph here, if you look on the horizontal there between 10 and 20. So 15 minutes, and you go straight up. And where that little triangle is, that shows that there is a 14% benefit if you exercise for 15 minutes a day compared to if you didn't. And that's all-cause mortality, not only cancer mortality, but everything. So if you want to reduce your mortality and extend your life, exercise seems to be the best thing that you can do for yourself. Physical activity is not necessarily exercise. And we're not talking about any exercise. We're talking about moderate intensity exercise. So moderate intensity exercise means that you break out a little bit of perspiration. You know, I have a little dog. I have a little miniature dachshund. So we walk her. But I wouldn't call that exercise, because my dog, you know, takes 2 steps, stops and smells, takes 2 more steps, stops and smells. Now I might be out there a while and I might, you know, take a number of steps, but that's not really exercise. Exercise is more continuous, where you're actually keeping your heart rate up a certain length of time and you begin to perspire a little bit. So you get a little dewy on the forehead.